Today we will going to see the hepatitis, next chapter on GIT, gastrointestinal tract diseases. In this we will going to see today hepatitis. Hepatitis means inflammation. Hepatitis, it is the inflammation of the liver. It is the inflammation of the liver. Now see here, the types are there. Types of the inflammation of the liver. So many types are there. Depending on one of the type, that is depending on the duration of the action, is according to the duration. It is of two types, that is acute hepatitis and chronic hepatitis. Acute hepatitis and chronic hepatitis. Acute means what? Duration is less. Chronic means long duration. So according to the duration, there are two types of hepatitis, that is the acute hepatitis and chronic hepatitis. Okay. Second one, infectious hepatitis. Second one, infectious hepatitis. In this, three types are there again: viral hepatitis, parasitic hepatitis, and bacterial hepatitis. In this viral hepatitis, again it is divided into hepatitis A, B, C, D, E, and G. See here, viral hepatitis, again it is divided into hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E, and hepatitis G. In detail, we will going to see afterwards. Now, listen this much only, the types of these viral hepatitis. Now, second one, that is the parasitic hepatitis. Parasitic hepatitis. Third one, bacterial hepatitis. Means in this second type, infectious hepatitis, again three types, subtypes are there, that is viral hepatitis, parasitic hepatitis, and bacterial hepatitis. Now third one, that is the metabolic hepatitis. Third one, that is the metabolic hepatitis. In this metabolic hepatitis, again three types are there: alcoholic hepatitis, non-alcoholic hepatitis, toxic and drug-induced hepatitis. See here, metabolic hepatitis, third type, that is again subdivided into alcoholic hepatitis, non-alcoholic hepatitis, toxic and drug-induced hepatitis. Fourth one, neonatal hepatitis. By birth only, this hepatitis inflammation of the liver takes place. This is called as neonatal hepatitis. Next one, autoimmune hepatitis. Next one, autoimmune hepatitis. Next, ischemic hepatitis. Ischemic hepatitis. We will see all these types in detail. So these are the types of the hepatitis. Which are those? Six types are there. Depending on the duration: infectious hepatitis, metabolic hepatitis, neonatal hepatitis, autoimmune hepatitis, and ischemic hepatitis. Now see the etiology, causes. These are the types, and causes according to the types are there. Okay, so we will see one by one. Causes of the hepatitis are according to their types. According to their types. Now, first one we will see viral hepatitis. Viral hepatitis. It is the most common type of the hepatitis. There are 5 types of the viruses. Hepatitis A, according to that viruses, the types are hepatitis A, B, C, D, and E. Okay, and G also is there. So first of all, hepatitis A and E behave similarly. Hepatitis A and E behave similarly. They are transmitted by fecal oral route. Now listen carefully. These are transmitted by fecal oral route. They are self-limiting nature and do not lead to chronic hepatitis. These are undergoes because of these viruses A and E only causes which type of hepatitis? Which type of hepatitis? Only the acute, which will not go to the chronic hepatitis. Now you understood this one, fecal oral route. That's why we used to say always, we do not eat outside. Do not eat which are kept openly. What happens? And do not go to the toilet openly. So what happened? All the flies, they are sit on these stools and they will fly and they will eat the open food material. So it is the circle, fecal oral route, isn't it? Because of this one, it causes, again we will eat that open one, which are the flies sit on that one, and again we will eat. So this is the fecal oral route. Do not eat the outside openly. The water, the fresh safe water we have to have, isn't it? So these hepatitis A and E are similar, and other B, C, D we will see again that causes are different. And because of this A and E, main cause is what? Fecal oral route. Transmitted by the fecal oral route means mainly it is transmitted from the water, or mainly transmitted from the these flies, isn't it? Food material open, which are kept open. Okay. So these are only the acute causes, only the acute hepatitis. It will not lead to the chronic hepatitis. It will not lead to the chronic hepatitis. Understood this one? Now see this one. The next one, that is the hepatitis B, C, and D. These are similar one. A and E are similar, and B, C, D are similar. So the causes are also different. The causes are also different. Etiology, that is causes, that is the etiology is also different. These are transmitted by sexual contact, sharing of the needles, mother to child. So this is the main root cause. These are transmitted by the sexual contact, sharing of the needles, easily transmitted through the needles, and syringes contaminated with the infected blood, and mother to child. Means pregnant woman, if it will infected, it passes to the baby, isn't it? So during the childbirth, it will, the virus, they will affect during the childbirth. So these are three main root causes of this one. And next type, that is the parasitic hepatitis. Parasitic hepatitis, the main cause, parasites can infect the liver and activate the immune responses, It leads to increase the serum immunoglobulin E. It increases the serum immunoglobulin E, known to cause the liver inflammation. See, this A and E are similar, B, C, D are similar, and the next one, the etiology, this is also different. Parasitic hepatitis, which is caused due to infection of the liver. Okay, it activate immune response, mainly that is the serum immunoglobulin E, and that causes the liver inflammation. This is the main root cause. Now next one, that is the bacterial hepatitis. Bacterial infection of the liver commonly results in pyrogenic liver abscesses, acute hepatitis or chronic hepatitis. The bacteria will infect the liver. Commonly, it causes what? Pyrogenic liver abscesses. Swelling of liver abscesses means what? Pyrogenic means what? This is the fever will come in that, and the liver abscesses, swelling of the liver, it takes place in this case, acute hepatitis or chronic hepatitis due to infection of the bacteria. In pyrogenic hepatitis, most commonly involved the enteric bacteria, that is E. coli. These E. coli are already present in our intestine. E. coli are already present in our intestine. If more than that, our limits, beyond the limit, it causes the infection. So bacterial hepatitis, it is mainly due to the our enteric bacteria, that is E. coli, that is Escherichia coli, E. coli. Okay. Alcoholic hepatitis, name itself indicates, due to the more consumption of the alcohol, it causes the alcoholic hepatitis, that is excessive alcoholic consumption causes the alcoholic hepatitis. Here also the liver abscess will take place, okay, inflammation or swelling of the liver, it will take place. Non-alcoholic hepatitis, it is not depend on the alcohol consumption, though the individual will not consume the alcohol, then also causes the hepatitis, that is called as a non-alcoholic hepatitis. It is also called as a non-alcoholic fatty liver diseases. It is also called as a non-alcoholic fatty liver diseases. It ranges in severity and reversibility from non-alcoholic fatty liver disease to cirrhosis or liver cancer. It may lead to, it may causes severe, and it also goes to the next stage that we called as a liver cancer or cirrhosis. That is the swelling of the liver. Water will accumulate in the liver and may causes the liver cancer. Non-alcoholic fatty liver diseases occurs in the people with less or no history of alcohol. Already I told you, no history. There is no any history. The individual is not consuming any type of the alcohol. Okay, then also this liver disease will take place. Hepatitis will take place. It is strongly associated with metabolic syndrome, which it is associated with metabolic syndrome, obesity, insulin resistance, okay, hypertriglyceridemia, diabetes, hypertension, old age. Due to all these, there may be chances. Which chances? Maybe due to metabolic syndrome, due to obesity, due to insulin resistance, due to hypertriglyceridemia, due to diabetes, due to hypertension or old age. It is strongly associated with, if the individual is having these all, there may be chances of getting this non-alcoholic hepatitis. The disease can progress further, exaggerated, it will increase, it will progress further, involving the liver cell death, liver inflammation, and fibrosis. May further, if you will not treat that time only, it will further exaggerate, it will further increase, it will further get progress and causes the liver cell death and liver inflammation and fibrosis. So that's why the liver damage will take place. And sometimes maybe there are chances that this last stage transplantation is any option. Now, toxic drug induced hepatitis. This is all about this one. Next one, that is hepatitis. It is due to toxic drug induced. I will tell you one simple medicine. We are using this medicine, OTC product, okay, over the counter, okay, over the counter OTC. This is the paracetamol. We are using paracetamol OTC, isn't it? No need of any type of the doctor's prescription, but this is the main paracetamol causes the hepatitis, liver damages. Okay, so should not take paracetamol or should not take any type of the allopathic drug unnecessarily. Okay, for simple pain. Okay, for simple pain, headache means any type of the pain. So do not take that type of drugs. Okay, in that, once mainly that is a paracetamol, it causes the hepatitis. Many chemicals, drug, industrial toxins, herbal and dietary supplements are known to cause hepatitis. Though these are herbal, then also some of the herbs causes the liver hepatitis. So though maybe Ayurvedic drug or allopathic drug should not take unnecessarily. Okay. So these chemicals, some chemicals, drugs, industrial toxins, herbal and dietary supplements, unnecessary, do not take the vitamins, isn't it? Some dietary supplements, extra dietary calciums, vitamins, iron, we are taking proteins, isn't it? So do not take unnecessarily, or this is the root cause of this hepatitis. Okay. Severity of the drug induced liver injury varies from acute to chronic. Acute hepatitis to acute liver failure. Acute hepatitis to acute liver failure may causes the liver failure due to these toxic drugs. Unnecessary, should not take any type of the drug, any type of the dietary supplements, isn't it? Though they are Ayurveda or though they are allopathic. Okay. So causes what? It causes the liver injury. It causes the liver injury, and it will produce acute hepatitis, and it will progress and causes the acute liver failure. Example, see paracetamol, oral contraceptives. Some of the women, they will take oral contraceptives, so do not take that one. Steroids, isoniazid, no, erythromycin. Okay, these are the antibiotics. Isoniazid, this is the anti-tubercular drug. You will come to know next year. So one two example for you, for you this year. It's okay. Paracetamol, oral contraceptives, steroids. Okay, this is sufficient for your level. Many herbal medicines, many herbal remedies and dietary supplements have been reported to cause the hepatitis. See, many herbal remedies are also there. Dietary supplement, before only I told you, isn't it? Reported to cause the hepatitis. Reported to cause the hepatitis. These are all about the uh, toxic drug induced the hepatitis. Next one, that is the autoimmune hepatitis. Autoimmune hepatitis. This is a chronic disease caused by abnormal immune response towards the liver cell. Autoimmune, this is the automatically the immune system will be get increases, and this causes the liver cell death. Okay, damage to the liver cell. Autoimmune hepatitis is a chronic disease caused by abnormal immune response. Our immune system will abnormally produce, and due to that our self immunity causes the death of the liver cell or damage to the liver cell. This is called as a autoimmune hepatitis. So what is the main role of the liver? This is a metabolism. What happened due to this autoimmune response? The metabolic system may be hamper, may severely it will increase, metabolysis may increase, or sometime it will decrease. What happened? Metabolysis is fast, then what happened? If we will take the drug, it will go fast excretion, isn't it? Is excretion will be fast, so we can't get that effect. So what happened? Again and again the individual will take the medicines to get the response. This is about the autoimmune system. Okay. Before also we explained in that one autoimmune. So this is the autoimmune hepatitis. Genetic hepatitis. Genetic means the main cause of this includes some of the deficiency is there. Alpha 1 antitrypsin deficiency is there. Okay. Hemochromatosis and Wilson disease. Here, in which disease? This alpha 1 antitrypsin, due to this deficiency, it causes by birth only the individual is not having this type of enzymes, some type of the enzymes, some type of the proteins, they are deficient to this one. So due to that deficiency, it causes this type of deficiency. Okay, this type of, due to that deficiency, it causes the hepatitis. In alpha 1 antitrypsin deficiency, there is a mutation in gene, change in the amino acid. Some of the amino acids, mutation means change. Change in the one type of the amino acid causes what happen? The gene leading to accumulation of the protein within the liver cell causing the disease. Proteins means what? It is the long chain due to the primary This one, which one? Due to that amino acid chains together, it develops the proteins. So if any one amino acid will change, that is the mutation change, then also the wrong protein will produce, and due to that long protein causes the wrong function of that protein, and due to that accumulation of this type of wrong protein within the liver cell causes this type of diseases. Okay, this type of diseases. Now see, hemochromatosis and Wilson disease involves abnormal storage of minerals. What happens in this disease, hemochromatosis and Wilson disease? Abnormal storage of the minerals. Abnormally, the minerals will stored into the liver. In hematochromatosis, there is accumulation of iron. What happens in that disease? Abnormally accumulation of the iron. And in the Wilson's disease, there is the abnormal accumulation of the copper in the liver and brain. See here. What happened in that disease, Wilson disease? Abnormal copper will deposited in liver and brain. So due to what main root cause? This is the due to deficiency of alpha-1 antitrypsin, alpha-1 antitrypsin deficiency. And due to this one, it causes the hematochromatosis and Wilson's disease. Hematochromatosis, the name itself indicates due to accumulation of the abnormal accumulation of the iron, and Wilson's disease, in this disease, abnormal accumulation of the copper in liver as well as in brain. Okay. Now, ischemic hepatitis. Ischemic hepatitis, this is also known as shock liver diseases. This is also known as ischemic. Ischemia means reduce the blood supply, reduced the blood supply to that, it's called as ischemic. It is also called as due to that the shock we also observed in this angina and everything. Then ischemic heart disease is also same. So it is also called as a shock liver disease. It results from reduced blood flow to the liver. Reduced blood flow to the liver. The condition is commonly associated with the heart failure, but can also be caused by shock or sepsis. Due to that, it also causes the septicemia, sepsis. Okay, associated with the heart failure. One disease may be related to the another, exaggerate. If you will not treat, it will convert it into the most one progressive, it will become the increase, it will become progressive and causes the another disease, another damage of the organ, isn't it? If the heart failure is the one of the reason, but can also be caused by shock and sepsis. The patients also shows the high levels of transaminase enzyme, AST and ALT, aspartate transaminase, AST, aspartate transaminase, and ALT, that is alanine transaminase. These are the enzymes. These are the liver enzymes. Okay, it rarely causes permanent liver damage. This ischemic heart disease we can treat. So this is rarely causes the permanent liver damage. No chances of having the permanent damage of the liver. We can treat, we can cure. So no, there is no permanent damage of the liver. So ischemic heart disease understood is also called a shock liver due to what? Due to reduced blood supply to the liver. Okay. These the individual shows the high levels of AST and high levels of ALT. These are the transaminase enzymes are there. These are the enzymes of the liver. Okay. Now neonatal, it is caused due to hepatic viruses. Due to hepatic viruses. If it will affect during the birth, that is called as neonatal hepatitis. We know the neonatal jaundice also. We listen, we studied that one. Like that only it is due to the virus. If that during the birth, if the virus is affected to the that baby, this is called as a neonatal hepatitis. It is due to the hepatic viruses. This is all about the etiology of different these types, different causes are there. Okay, so we will see the symptoms. A and E are similar, isn't it? So similar symptoms are there. Which type of symptoms may be? Jaundice may cause due to the joint. This produces jaundice due to hepatitis. Jaundice means only what? It is the damage to the liver, inflammation to the liver. It causes the jaundice. So symptoms: jaundice, fatigue, itching, loss of appetite, low grade of fever, nausea, vomiting, abdominal pain. All are similar symptoms of this one. These are the symptoms of hepatitis A and E, because A and E are similar. That's why the similar symptoms are. You may write here the jaundice symptoms also, because this is the symptoms in this hepatitis, jaundice. Due to this hepatitis causes the jaundice, isn't it? So you can add the symptoms of the jaundice also. These are the loss of appetite, loss of this one, a low grade of liver, nausea, vomiting, abdominal pain. You are seen in the jaundice also, fatigue, itching. Okay, yellow eyes, yellow this liver, the urine, yellow coloration of the sclera of the eyes, isn't it? All the skin will become yellowish. All these one symptoms of jaundice you can write down, because of this hepatitis causes the jaundice, isn't it? So next one, that is the hepatitis B, C, and D. These are the similar one, B, C, and D. What are the signs and symptoms here? Joint pain. Here also the jaundice is there, fatigue, itching, loss of appetite, low grade of fever, nausea, vomiting, abdominal pain, weakness, and fatigue. Symptoms are little bit same, but joint pain is also here included here. Joint pain, jaundice, fatigue, all are similar, isn't it? Now see the neonatal hepatitis. Neonatal hepatitis, bile duct obstruction, jaundice, pale stool, dark urine, enlarged liver, slowed growth. Growth is very slow, irritability, itching, portal hypertension sometimes, isn't it? So these are the symptoms of the neonatal hepatitis. These are the symptoms of the neonatal hepatitis. Which are those? One, bile duct obstruction in the bile duct, so that the bile will not come from the liver to the gallbladder or to the small intestine. So there may be problem to the due to obstruction. Jaundice, pale stool, dark urine, enlarged liver, so that the abdomen will become swollen, isn't it? Due to that, liver is enlarged. Due to that, growth is slow, irritability, itching, and maybe some portal hypertension. Now see, we will see the diagnosis. According to the types, the diagnoses are there. A and E are similar. That's why the similar diagnosis, physical, everyone they are having the physical examination. What here they will check here, the doctor will check, the examine the liver. What they indicate after checking that one? Enlargement and tenderness of the liver. Enlargement and tenderness of the liver. Blood test, raising of their type of the enzymes, transaminase, ELS, or yeah, this one. Before only we see these enzymes, AST and ALT, aspartate transaminase and alanine transaminase. These type of the enzymes we can see, if they are increased, they will come into the blood. So raised IgM, immunoglobulin M, immunoglobulin G antibodies to the hepatitis A. There may be ranging increased levels of IgM and IgG. Liver function test. What we have to check here, the liver function test. Elevated liver enzymes, AST, ALT. Okay, especially transaminase enzyme level. Before only we seen AST and ALT. So it will be get increased. Now see here in the hepatitis B, C, and D. Physical examination indicates the same, that is the enlargement and tenderness of the liver. Blood test. Here also the raised HbS, Ag, and AgM antibodies raised. hemoglobin and Ag and IgM, immunoglobulin M antibodies. These are the antibodies. Raised HBe antigens. Sometimes this also will increase. Liver function test, elevated liver enzymes, especially transaminase level is increased. Little bit similar is there, but this is the main. This is the raised HBs, Ag and Ig immunoglobulin E antibodies. So these levels of antigens are in, these antigen levels are increased and these antibodies will be increased if we will see in the blood test. Now next one, that is the ultrasound. Ultrasound sonography is same, painless and imagining study. We will see the all the photographs with the help of the sound waves to examine the structure of the liver so that we can understand the where the inflammation takes place. Okay, and CT scan also similar to that of the X-ray that provides more details of the structures of the liver. Liver biopsy, a needle same technique is same, but this is which biopsy we have to take here? Liver biopsy. A liver is needle is inserted into the liver to remove the piece of the tissue for the examination, and by finding that one, the if we will check that one, something of the benign tumor or some anything we can check in the laboratory, so that the biopsy will help us the exact cause of the hepatitis, why the inflammation of the liver takes place due to benign tumor or something. By checking that piece we can understand which type of the inflammation is there. Okay, this is all about the diagnosis. Now see the treatment. Hepatitis A and E, because these are similar, so treatment are similar. There is no specific treatment of hepatitis A. Recovery from symptoms following infection may be slow and may take several weeks or months, because there is no any treatment for, actually there is no any treatment for the liver. There is no any treatment for the jaundice also. Okay, so we have to take the safe food, safe water. That is the main thing here. Okay, recovery also very slow. It takes months together or weeks together. Therapy is aimed at maintaining comfort and adequate nutritional balance. Here also they said same. We have to maintain the balance. Which balance? The nutritional balance, including the replacement of the fluids that are most from vomiting and diarrhea. Fluids, whatever you are taking, that are should be clean, clear, and mm, the fluids are we have to give the which type of the fluid, because there is a chances, there are the symptoms of vomiting and diarrhea, and due to that in our body we are lost the most of the fluids, isn't it? So to fulfill that one fluid, we have to take the outside fluids. Okay, that should be that should be bacterial free, virus free, that should be uh, clear from all these, isn't it? So filtered one we have to take. Other fluids, that is electrolyte or glucose or some other fluids, juices, we have to take to replace the fluid which is lost from the vomiting and diarrhea. Restrictions of diet containing the fat. We should not take the oily food material. Okay, simple diet we have to maintain. Okay, fruits, juices, isn't it? Rice, dal, like that. No any type of the fatty material, no any oily material. Okay, full strictly restriction, because it causes again the nausea and vomiting sensation. And take the bed rest. Lactulose to reduce the absorption of the ammonia from GIT and to empty the bowels of the nitrogenous substances. Lactulose to reduce the absorption of ammonia from the GIT and to empty the bowels of nitrogenous substances, we have to take the lactulose. This is all about the treatment of hepatitis A and E. Now see, these are B, C, D, hepatitis B, C, D, same as above, whatever the same treatment here also. The standard treatment from the hepatitis C is combination antiviral therapy, which is that one, interferon and ribavirin. Two examples I have given here, which are effective against all genotype of hepatitis viruses. Means these are all due to the hepatitis is due to the viral infection. So we have to take the antiviral therapy also to reduce the growth to kill the viruses, so that we have to give interferon or ribavirin. Some of the example I have here. Here in the neonatal hepatitis, there is no specific treatment for this hepatitis. Vitamin only, we have to give the vitamin supplements are prescribed that will improve the bile flow. That will improve because this hepatitis, neonatal hepatitis, is due to obstruction of the bile, isn't it? So what happens if you will give the vitamin supplements? It improves the bile flow. Okay, due to that vitamins. Now, how to prevent that one? See here, hepatitis A and B. This is due to what? This is main root cause is that fecal oral route, isn't it? Main etiology is fecal oral route. So supply the clean food and water. Clean food and water. Do not eat the outside one. Proper disposal and sewage with communities. You can understood this one. Proper disposal should be there, isn't it? Sewage disposal from the locality. Okay, personal hygiene practice, wash the hands clear. Okay, personal hygiene, you have to maintain that one by using the soap and everything. Okay, after toileting and then such as regular hand washing with safe water. Okay, vaccination should be there. Vaccination you have to do. Public health education, the government will educate the how to maintain the public health. Okay, so all these are the prevention of the hepatitis A and E. Okay, now B and BCD, regular cleaning of the staff handling the blood and serum products in the laboratory. People, they are like, because this is due to what? Contact of the needle, isn't it? So due to that one, the staff should wash the hand carefully. They should handle carefully the blood and serum products. Okay, because due to this is contact transmitted to from the blood and serum products, transmitted from the needle. So that's why we have to handle carefully these. Use the disposable syringes and needles. Everyone now they are using in the hospitals. Everywhere they are using the disposable syringes and needles, isn't it? Avoid the use of cold plasma. Okay, should not use cold plasma. Screen the blood donor for hepatitis B infection. If someone is donor, you should examine the blood should be free from the hepatitis infection, B infection, because what happened here? It is transmitted mainly BCD from the blood serum, isn't it? So when the donors are there, we have to check whether the individual is free from hepatitis infection or any type of the infection, that we have to check. Give the sex education, vaccination, proper vaccination, and public health education. Risk factors due to poor sanitation, lack of safe water, injections, drugs, living in a household and infected persons, being a sexual partner of someone with acute hepatitis A infection, traveling to the areas of high endemic city without being immunized, blood transfusion, sharing the infected syringe or needles. These are the risk factors. Due to these factors, there may be chances to get the hepatitis. Okay, so this is all about the hepatitis. Understood this one? all the types, and according to the types, the etiology is there. According to that types, the signs and symptoms are there, and according to that, the diagnosis, treatment, and prevention. And also we seen the risk factors. Okay, this is all about the hepatitis. Now we will stop here only.